taking time to see us today here on Chairside with Dr. Vava. I'm looking forward to this conversation with you.
Thank you, Dr. Vava. Thank you. This is very nice. My first time on a podcast, so that allows me to experience something new. And I'm looking forward to this conversation which we're going to have. I think it's something which is needed at the right time.
No, thank you very much for those remarks, Bomi. But without wasting any of your time, let's start with the person behind the philosophy, behind reinvention, behind leadership transformation, behind life coaching. Who is Bomi Ntolosi?
Well, a recent term I've heard now, I'm a PK. Okay. So you're wondering what is a PK?
Sounds like a 2K.
Well, when I listened closly, they said it means pastor's kids.
Okay, all right, okay.
So
yes.
my father was a pastor. I grew up in church. And I remember when I was probably about 10 years old, somehow I was made to stand in front of a congregation. And there I was crying. I'm looking at all these people looking at me. I'm thinking, shoo, can you stop? What are you looking at me for? And so that was kind of a way to stand up there and lead. As I reflect on that now. Is it something which we are ready for? Definitely I was not ready for it. But that's something which I feel it kind of took me into places where even up today, I find people look and see things in me which I probably don't see, or something that I don't see, let alone to acknowledge it. Whether I'm in church, home, or work, and I call that it's what God has placed, not just in me, but in each and every one of us, to lead from where we are.
Now, Bomi, let's now talk about you as a professional. Did you always see this happening? Did you ever see yourself working in leadership development, in organizational development, and in particular, becoming a reinvention practitioner?
Definitely not a reinvention practitioner.
That took you by surprise.
That's something which just came now. Probably indicative of the world we live in, which is not confined. Things are changing so quickly. So definitely growing up, I never thought of even anything close to reinvention practitioner. Leadership development, I certainly didn't think of it in the way now that I'm thinking about it. I thought of a leader as someone who you look up to and is for certain people. Whether I'm at work, there is a manager or a leader who's got a corner office somewhere. I'm not a leader, that's a leader.
Has the fancy suit.
Has the fancy suit, Probably paid too much more than I'm getting paid.
Of course.
And so I thought that's where it starts and ends, in a way, being a leader. I never thought that it could be something so evolved. By the way, I think it's always been there. As I said, I grew up in church. I got to immerse myself in scriptures. I got to understand when God said, I want you to have dominion over the earth.
Okay.
When he created a human being. That to me said there is a leadership role which you need to have as human beings. So this leadership thing is not just for a certain few people. It's for all of us. If we can only live in God's intended purpose and be the real true people who we intended to be.
Okay. So, Bomi, it is quite clear that your growing up in church, your spirituality in this particular case really played a role. But one would also argue that, the Bible in itself as just the document would not have been the only influence in your development and in your leadership development journey. So from what you remember, were your early influences in terms of what indeed looked like leadership at a very practical level, very tangible level, not spiritual and abstract in this case? Who were these examples that then, of course, went on further to kind of, I would say, entrench the influence of your spirituality in terms of how you define leadership? Please do share that with us.
So leadership is in us and amongst us. If I were to say to you, I knew it way back then, I'll be lying about it. But in every person I have met, as at my age, as old as I am, there is something which I've learned. The standard answer will probably refer to people who we know and they are well advertised in terms of who they are, Nelson Mandelas of this world, and so on. But you could even miss the person you are with in the room, like my father.
Yes.
That I have learned so much from him. He was a mentor.
Okay.
The way he was doing things, how he was doing life. There are people I met in church organizations where I was. There are people I met at work, my siblings, people who... There is always something which I have learned, and it has shaped me. And I've met myself many times in the process. And I keep meeting myself. And so those are the kind of, I would say, people who have inspired me in terms of this journey, of this leadership journey. So that I can be able now to really look back and see, you know what? Yeah, there is so much wealth which I went through, learned to be where I am. And I need to appreciate that.
No, thank you very much. I think that gives us a nice foundation for our conversation. And we will be going into the meat and the nitty-gritty now of this particular conversation we are having today. Bomi, now into the meat of the conversation, reinvention. For those who are watching our episode today who don't know what reinvention is, what is reinvention, broadly speaking, and beyond reinvention as a philosophy or a management philosophy? What's the implication of reinvention for oral health care, in particular within the context of South Africa and the challenges that we are experiencing in oral health care? We're talking here a system that has remained the same for a very long time, very little changes, a lot of new technology to improve the procedures we do, but much of the same problems still prevailing. Issues of leadership, issues of bad governance or incomplete governance, issues of systems that are not front and center positioning communities, and what the whole of society gets to gain from being empowered through oral health. Those are the systemic challenges that remain and are a legacy of many of South Africa's difficult, or rather South Africa's difficult history, if I would say. Now, we are going to unpack this systematically, but please unpack reinvention for us.
That's an important question there, Dr. Vava, you are asking in terms of what is reinvention in the context especially of oral health or oral health care. So what is the concept of reinvention? When we talk reinvention, it's a practice of embracing change.
Okay.
And it means that we are systematic in our approach to thrive in chaos. When we have all these kind of things all happening at the same time, And it's a way to foster sustainability in that system, which we are doing. It's an immune system, which means we want to be able to buffer ourselves against all that chaos and everything else which is happening. It's an effort. Reinvention is an effort, but it's a structured and deliberate effort. So we don't just do things in terms of that. So that we do that in healthy cycles of planning and renewal and making sure that we keep going back and forth over and over again in terms of
So this is definitely not a static process.
So definitely it's not.
So it prides itself in a dynamic environment, and creating a dynamic environment in teams. In fact, internally and externally. I think, yes.
You've got it. You've got it. Because how else can we do it in the face of all the chaos, the disruptions which are happening? It needs a system which can be able to respond to that for it to be healthy as a system. So reinvention, as was introduced by Dr. Nadya Zhexembayeva, she went from being an academic, went into private practice, moved from Russia to the States. Well, back then, Russia was the Soviet Union. She went through the breakup, and as a province, they found themselves now all of a sudden without a currency, because now they are becoming a country on their own, as the Soviet Union was breaking up. So it was literally a place where you start from scratch. There's chaos. Disruption,
I was about to say.
Everything in them. So she looked at something which we all go through life, if you think about it. When a child grows up, they go through stages.
Yes.
They are reinventing, if you think about it.
Yes.
When you grow a young adult and you get into adulthood and you get married and you have kids and so on, or in your career, you are moving from one place, you are reinventing. So which means you are finding ways in terms of embracing the change which is happening. So what's so different about that? But she found a way then to say, you know what, this is a concept. This is something for people to learn, something for people to be comfortable in, so that they can be able to do what they need to do when they need to do it. So with reinvention, it looks at life and recognizes that life goes through a cycle. So things start, they grow and they go up at plateau and then come down and die. And this concept of reinvention, it says you don't need to wait for things to die. So they can start grow before they get to the plateau stage. You start another curve of growth. And you can continue as far as you want to in that sense, so that in the face of disruption, you are not left having to do this exhausting exercise of starting, stop, start. Stop, start. Because when you go down and grow, you're going to have to do more and more work to go and start again. And life is too fast, and there's too many things, disruptions happening. There's less and less resources to do what you need to do with, to keep things going up and down like that in terms of life.
And if I may, this concept of the S-curves, right?
Yeah.
That before you start your dip,
Yes.
after the plateau,
Yes.
you should have started working on your next so-called elevation or your next journey up.
Yes.
Now, it's very clear for many people who are probably watching this episode, they probably will be thinking to themselves, they hear this S-curve thing, they wish maybe we had something in the background just to demonstrate and show it. But maybe to bring it closer to home and actually ensure that it has some practical value. This analogy of being able to prevent you dipping over to the valley and trying to build yourself up again from a place of a very low valley back again to some level of plateau is what we are trying to avoid with this approach, with reinvention. Applies to organizations, applies to individuals as well. Now, in order, of course, if I hear you correctly, to take advantage of reinvention as an oral health care leader, as an oral health professional, as a human being, just a simple human being.
Doing life.
You have to understand and embrace the fact that, one, change is inevitable.
Yeah.
Two, that with change being inevitable, you need to anticipate in your own life, in your own organization, when change is required, when change may visit you unexpectedly. Meaning that, as you were saying, if I'm an organization and I've been operating for the past 3 years, the numbers look good, the system looks like it's now nice and perfect and needs no tweaking. This formula is working.
Absolutely.
If we are to think about this S-curve analogy within this philosophy of reinvention, you are saying perhaps that's the point where you need to start preparing.
Yes.
Because you may have reached your plateau. So mine is to say, how do we make that practical for oral health professionals, for healthcare professionals in general? And perhaps if we can, maybe we'll go into this a little bit further in the conversation, but let's bring that S-curve closer to home so that people really understand, if that is how a reinvention works, how do I anticipate the change? When do I know that it's time for me, because I'm about to drop? I'm about to drop right now. Things feel good. I'm doing very little. When do I know how to anticipate the change or to be ready? Because sometimes we may miss anticipating change, but at least to be prepared for it.
Yeah. Thank you for that. There are so many layers into it and being ready for that. But I will, because we can talk here forever.
Yes.
But just to summarize it and say, there are stages for us to be able to take advantage of the S-curve. By the way, it doesn't need to get into the plateau, but as it approaches the plateau, which means
the plateau in this case, bliss. Everything is working.
Everything is working
are working.
fine.
No one stealing money. No one.
And it's difficult to act from that because you are bliss.
Yes.
But
you don't want to change anything.
But you have to know what comes next is going down.
Yes.
So before you even reach the plateau, when you are growing, you need to anticipate change, first thing, like we are saying. Secondly, you need to design the change. And thirdly, you need to implement the change.
Okay.
If I can make an example, in an organization like a business organization or corporate, you will have the owner or the president of the company very good at anticipating change. That's what he does. He can read the market and he thinks, you know what? Things are about to change here. Let's get ready. Then he has his executive team to say, let's design the change. Well, if he talks to them and without talking to the rest of the team to implement the change, do you know what has happened? It was just anticipated, it was designed, and it was left on the shelf as a nice little book to say this is what's going to happen.
Okay.
There's no point of it, and it's as good as nothing. And then you fall to that trap again. Or the big guy says, listen, I can anticipate what's coming. Let's implement it quickly. Things are about to change. There is no design on the change. So what happens? The implementation struggles. If you think of a multinational company, they come up with a change. In South Africa, this is how we implement it. If they are also represented in Brazil, they want to implement what they're implementing in this country, and it doesn't happen there. Why? Because the laws are different. The atmosphere is different.
The people are different.
The people are different. So the design is important in terms of saying, listen, so we can bring those elements into closer to oral health care, to health care in general,
Yes.
to professionals and everybody involved to say, first, anticipate the change that is coming. You might think that you are at a stage where you are growing or things are happening, but be sure to know that there are things which are going to happen which are not going to help you in the long run. So what is happening in terms of change, in terms of that?
Bomi, you've said a lot about reinvention as a philosophy, both as a management philosophy, leadership philosophy, and if I would say so, a life philosophy. Now, someone is sitting and probably asking themselves, but why reinvention? There are so many other philosophies out there, and why is in reinvention so important? I mean, I would probably have my own bias around it, but I look at it, listening to the account you just given, I look at it as a very dynamic philosophy, number one. I look at it as one that is probably best poised to respond to the chaos of today. There's a lot going on. There's a lot going on. Things are changing faster than we thought. But I want to, for you are the reinvention practitioner. You understand this philosophy. You have implemented it in organizations. You have seen and you've implemented it and used it to help people to cope with change, to anticipate change, to plan for this change as well. And mine is to then ask you, why reinvention? Why reinvention now?
Thank you, Dr. Vava. Well, why reinvention? Reinvention, like many philosophies, they are talking to the times we live in and trying to respond. So what tends to happen from an individual point of view or even organizational point of view, we tend to dip our heads in the sand.
Okay.
And pretend that things are not happening when they are actually happening. In reinvention, we call that Titanic syndrome.
Titanic syndrome.
Titanic syndrome.
Okay.
So if you think about it, what sank the Titanic? Many people think that it was the iceberg.
Okay.
But actually, there were people inside the Titanic who could have avoided the Titanic sinking. So if we define it, we look at Titanic as a disease in which organizations, and that could be anything from government, departments, or units like family units, whatever teams you're talking about, that are facing disruption, as we have just indicated, and they create their own downfall by being stubborn and arrogant about what is happening, because they are either excessively attached to their past successes,
Okay.
or they are not able to recognize that there is things which are happening and they need to adapt into something else new. And we can see plenty of that. Change is never an easy thing. In fact, if we could, we will avoid it.
Okay. And maybe if I am not interrupting again, it's now that we are kind of understanding that, you know, the Titanic had other role players, that catastrophe had other role players around it. Those who could have taken advantage of many of the three reinvention philosophies. And I'm sure the people listening to the episode will have an appreciation of that as we expand to it. But I just want us to just touch a little bit back on this question, really, why reinvention? Because there are other philosophies. So why are we saying reinvention now? Why does reinvention matter today? As you said, you want to answer that question, and we're going to explore this analogy of the Titanic and what happened there as part of the explanation. But just a short way in which without the elaboration, we can be able to say, but this is why reinvention Bulela matters now. This is why reinvention is needed now, more than ever. And perhaps to even take that and put it into oral health, as I gave you the background, that oral health in South Africa has had the same systemic challenges. I would even go and argue for the past 50 years. We've made very little innovations except the way in which we perform some of these treatments. But we have not gone beyond imagining what the systemic innovations could be, what the leadership and governance innovations could look like. Because it cannot be that we are saying for the past 50 years, South African oral health care has gotten a clean bill of health. We've done everything well, there's no need for change. So I'd like you, if you could touch a little bit on that as you answer this question, why reinvention, and why reinvention yet again now?
Well, maybe in a short answer is to
Yes.
say, back then, 50 years ago or even more, we used to deal with long cycles. Things used to take so long to change.
Okay.
Reinvention is relevant now because it recognizes that things are moving so fast. There are short cycles which we're dealing with. So you're talking about oral health care in what it is faced with. Believe you me, there is a lot of other entities or other situations which are faced by the same thing. They are used to long cycles, but now the cycles are very short. And what does that mean? It means you need to keep on reinventing yourself. As an individual, as an organization, as a system, and so on.
And my interpretation of this would definitely also be that now, if we come closer to home, that we look, for example, the way in which we've been training oral health professionals. Technology is coming in, there's AI, and what I've observed independently from a distance has been the very slow pace of being able to either anticipate the impact of technology on training, the impact of technology on how we treat and manage. But also, and when I take technology, I'm not talking about, for example, in our case, new fast hand pieces, new devices to make your workflows much faster so that you can see more people in half the time. But I'm talking about simple things, for example, like the role something like artificial intelligence is now playing in oral health. And whether or not is that a tool that we can embrace and leverage to deal with most of these systemic challenges that we have. The challenges of inequitable access to oral health care. I am very controversial at times, and I even call for this notion that it is not an innovation unless it's accessible. That's what I say. It's not an innovation unless it's accessible. You've not innovated in oral health, you are not trailblazing in oral health until your innovation can make the life of an ordinary person on the street significantly different. If it has not managed to change that life, you still have a lot more in your, they call it the R&D process, research and development to do. So that's what I normally look at. And I really appreciate, Bomi, your perspective around this.
We have to bring in the human element into the reinvention philosophy.
Okay.
Because it's nothing without the people who are driving it. Because people are the ones who are living life. And so, when we look at the person, we understand that there is biology involved in the person. Most of that biology, we have the brain, we've got the mind, which are the drivers of what we do. And so if we go any deeper to that, that's a whole other topic in terms of that, which we can explore maybe later on. But that's what we, as in terms of reinvention, recognize that dealing with change, whether you anticipate or designing or implementing change, that person who has to deal with that has got their own humanness, if I can call it that. So what does that humanness do, and how does it respond, and how do they deal with it as they proceed?
Thank you for really that commentary on the fact that there's the strategy, the approach is only as strong as the person behind it. And that basically reinvention should start from within before we anticipate seeing all these changes that we want to see. If Bulela is concerned about oral health care in South Africa as a system, the change by implementing reinvention as an approach will not start with the system.
Yeah.
It will start with the people who make up the system. That is the people in leadership, the people in training, the people who are still outside of what we traditionally frame as leadership. Because again, leadership doesn't become something static. Some people, as you said it at the beginning, you found yourself in opportunities to lead. There's someone who's going to resign or retire at the end of this year in one clinic, in one hospital, in one university, in one of these structures that make up the oral health care ecosystem of South Africa. And someone might find themselves not ready to jump into these shoes, to lead, to take on, of course, this new challenge. But again, as you are saying, reinvention will find its life, in particular when this person or these people take that journey first inward before we take it outward. We are now moving to what probably will excite many of the people who are listening to this episode today. And I want to kick it off with a Xhosa phrase first, or an idiom, that says, "Isizwe sifa ngomntu omnye." In translation is that a whole nation dies because of one person. Now, I want to bring this very close to home and try to tie up much of the previous comments that have come out of the conversation. We appreciate the role of the individual. Now, let's talk about this individual in terms of leadership. Now, how does reinvention as a philosophy now start to manifest in terms of leadership development, and in particular now in healthcare leadership? How does reinvention now come to life? And I say this with this background in mind. Most of our leaders are in the news for the wrong reasons all the time. The system, you go into the news, everyone will tell you that the public healthcare system of South Africa is broken, no one can fix it, and everyone likes pointing the fingers. Leadership is the problem. Leadership is the problem. Governance is the problem. Now, you've provided a nice framework for us. I think we can appreciate and understand what reinvention really offers as an opportunity here.
Yeah.
How does it come to life in healthcare leadership in South Africa?
Correctly, as we have discussed, that there's always human being behind all that. And how do we come into terms with our humanness? Maybe at a practical level, we can look at what life brings, including the change and the chaos and the disruptions, all those things which are happening. How do we make a point of making a distinction between what is in our control and what is outside of our control?
Okay.
And therefore be at peace, especially with what is outside of our control, and deal with it in that way. So the reinvention philosophy recognizes that we need to be able to do that and say, you know what, I know this is how far I can go with this. Because oftentimes we get into trouble because we can't accept. It's worse when the is so much disruptions and chaos and all these other things which are happening, and we keep pushing and keep pushing. Please hear me. I'm not saying let's give up.
Okay.
Because something is outside of our control. Absolutely, that's not what I'm saying. But what I'm saying is awareness is very important. Once you become aware that this is how far I can go, then you start to say, what else can I do? There's a beautiful, in terms of leadership, what we say in my company, our company, which is Heartprints Consulting, we're saying leadership is a wholehearted, or is a heart philosophy. So we practice wholehearted leadership.
Okay. Okay.
Which means it recognizes me and me, all of me. As a leader, if I come to a space to lead, I need to bring all of me in there. Maybe by that, I can also recognize that other people are bringing all of themselves into that space.
And if I can jump in, I mean, already for me, a lot of, I don't want to say signals are popping off with this idea of bringing all of you. I gave the background of a healthcare system in South Africa and an oral healthcare system in South Africa that has not, that grapples with this. There are people at the heart of the dysfunction we see. There are people at the heart of the little successes we are starting to see within oral healthcare, broader oral healthcare. However, again, as I kind of was trying to engage you and maybe strong arm you a little bit into some form of commentary, in particular about perhaps the public system of healthcare. There is this way in which we were taught and told that when you walk into the office, you leave the person behind. You will carry your jacket of your personality afterwards, out and at the door. That's the philosophy. You leave it outside the door, you pick it up on your way out back home, your personality. Now, you are highlighting that reinvention says, if we want to see the changes we want to see at a systemic level in oral health, because the systemic change will come by pockets of excellence coming together and coalescing around a much bigger vision. There will be the oral hygienist at the clinic. There will be the dentist at a private clinic or in a government clinic who then says, I want to lead better. They start doing so. Then we build on this on the back of there will be one who is tasked with the responsibility to coordinate these people, whether that can be a national oral health director, whether it's an actual HOD of the National Health Department, who then has a systemic view of these pockets of transformation that need to happen, right? But also they need to go into their own journey of reinvention, because I see this philosophy working from a bottom up and a top to bottom, and meeting at the middle somewhere, where what you are getting in that space is that the leader responsible and being responsible, or the one who is the custodian of the system, is going through reinvention and reimagining the system through a reinvention lens. But there are the individuals supporting the broader government philosophy or the broader government strategy as cogs at the bottom, also going through their own reinvention. Now, my understanding is that in looking at how this will practically transform leadership, we need both. We need both transformation at the top. We need both transformation and change at the bottom.
Yeah.
Is that really truly the case?
All of that has to be in there, because one of the things which usually happens is that when you lead and being not aware you've got blind spots.
Mm-hmm.
And if the other also has got blind spots, then you are both going to be on a negative path. And I'm referring to blind spots here in a way that our minds have got a way of being our friends, but they can also be our enemies in the way the mind works. So I don't know if somebody says, listen, I'll leave my personality or me outside and come in as just
And
as
operate
what?
within the bureaucracy.
Exactly.
Because the bureaucracy so often doesn't have room for a person to manifest their personality. It's got the system, it's got the tick boxes, it's got, is this being done?
Yeah. And the risk of that is that now you operate on one side only of the brain, which is the data channel. And usually that is usually based maybe on fear, or it's always negative. It never sees value, which is the right side of your brain, which is operating on love. It sees the other person as a person. It can show compassion for somebody else. And so it can see that, you know, the public is suffering. Let me be compassionate. Let me do 1, 2, 3 to help. Or as a team, let's work together. So you can't leave that behind. By the way, we have to admit that we are inborn, have a nature to love. We're created for love, by love. So there's no way we can move away from that. Otherwise, we leave ourselves, unfortunately, at the risk of just going negative, for even to the detriment of ourselves. Forget about the other person. So I'm saying, in reinvention, with all these challenges which need to be taken care of,
Yes.
that person who is part of that
Yes.
is running a risk of looking at reinvention as just a project. How quickly can we finish with this reinvention thing so that we can go back to normal? You know what I'm saying?
Yes, yes.
It's not going to happen, unfortunately. Or how can we finish this so that we can go back to how things used to be? It's never going to happen. We've moved on. Change is happening all the time.
Yes.
And more change is going to happen. So forget about how things were used to be. So when you do that, then, and you forget the person you are and what you are dealing with, you're not going to be effective in reinvention.
Yes.
And especially to have a reinvention mindset, which is able to say, listen, I always see what's coming up. Let me see, let me design, let me implement. In fact, what reinvention, we've got a philosophy there which says, leaders, they are disruptive, which means they see and anticipate change and they change things around. But you need to counter that with the management side of that change, which embed things and settle things down and say, okay, now this is working, not working, working, that's fine. Before you start again to be disruptive in terms of what needs to happen.
So you are actually saying, as we move on to the next segment of our conversation, you are actually now saying that, Bulela, to bring practical value to a reinvention in the public service, to bring real value in reinvention to the private oral health care system, public oral health care system, you are saying, embrace all of what you've just said, but at the core of it, and I love this duality of disruption and management. Because so often, Bulela gets an opportunity to lead a department. And Bulela has been working with reinvention, but forgets the management side of it and wants everyone to run with a new way of doing, forgetting that the system has been operating like this for decades. Gets bent out and bows out and says, these people are backward. No one here is committed to changing this public service so that it actually responds to communities' needs. But actually what would have happened in that case is that Bulela would have forgotten that you also need to manage. And you don't only manage the system, but you actually manage the people within the system as well. So my summary and take of this is that there needs to be a form of strength developed in the leaders who are currently custodians of our oral healthcare system, who are currently custodians of our healthcare system. They need to open themselves up. And by saying so, you are saying they need to open themselves up as individuals within the settings that they work in. Yes, the bureaucracy, once things done a certain way, is bogged down by hierarchy, is bogged down by systems that are embedded and are resistant to change.
Yeah.
But what I am hearing you say is that with reinvention, we can bring the heart back into that. We can bring people-centeredness into life and not make it just a subject of strategic meetings
Yeah.
and team building workshops, but take it from that setting and bring it into your clinical practice, bring it into your university where you are training this new group of oral health professionals or healthcare professionals, and that's how it's going to come to life. We've said a lot. Our conversation is coming to an end. Some people may have found it exciting. We've talked about something that is particularly new. People don't know what it really is. I'm also grappling with it and learning as I go. But here is an interesting, real-life, practical conundrum. South African government has published and released its 10-year strategy, 2024 to 2034. National Oral Health Strategy. There's a lot in the document, and I know you've seen it yourself. My question is a simple one. How does this strategy align with reinvention? We've talked about how reinvention prides itself in a dynamic environment, creating a dynamic environment, operating and creating a dynamic environment. And now we are faced with a situation where we've also agreed that change is happening faster than we could ever anticipate now. It's moving. And you even said, I think earlier, if I remember, that the time of things changing on 5-year, 2-year cycles is gone.
Yeah.
It's a thing of the past. We have a 10-year national oral health strategy in South Africa. How does this align with reinvention?
Thank you for that. That is, what did you call it, a conundrum?
Conundrum, yes, yes. 10-year strategy.
10-year strategy. Well, that sounds like then it's looking at things as the way they have been, which is, on its own, nothing is wrong with that.
Okay.
You need a view into the future. That's on the policy side of things.
Okay.
That's where you want to go, and that's beautiful. Now you come to the strategy of how do you get there. Now strategy has been and always been about, you move from a certain point A, you want to get to point B.
Yes.
Spend a lot of time trying to make sure that the decisions which you make about which point to move from and which point to go to is very sound decisions. Then the implementation just has to follow that.
Okay.
Now that was working at a time when we had long cycles, because it took long for things to really change and be disruptive in that sense. When you have short cycles, there are examples of budgets passed for the coming year. And 2 or 3 months down the line, we have to change the budget because we don't see ourselves getting through to the end of the year. We can bury our heads in the sand and pretend that, no, it was passed, so let's continue with it, but you're waiting for trouble to come through. So in this policy and the strategy document which has just come out, my appeal would be we have to look at something else. Remember, we still need a strategy document.
Yes.
There
is value in it.
There's value in it.
Good.
But there's a big but. When you are operating in an environment which keeps on constantly changing, you can't just be stuck on implementing that strategy. You need to be responsive to the environment. And therefore, what used to be a static strategy, we now talk about a divergent strategy.
Okay.
So divergent strategy, it means that we are recognizing that there's somewhere where we started and we are moving, but we are free to drop some things off which are not working and take on things which are going to be working. You are all this time still in strategy.
Okay.
So you get to a point now where you can say there's an emergent strategy. Because you recognize that there are things which are new and things which are old, which I've taken off. So my appeal would be that with this strategy document, we are not waiting for 2034 and then
to measure the outcomes,
and
right?
measure the outcomes or get feedback or responses. We may be getting those, but can we do something practical about them if we get the feedback? Because often what happens is, no, we've got a strategy document. The feedback comes, no, we've got a strategy document. But no, this thing is not working this way and that way. No, our
Cut off is
document
2034.
2034. It won't work. There needs to be practical engagement with a view of saying certain actions were taken, there's a certain feedback, and so what course of action are we taking? What I'm coming to then as a way maybe to just try to drive the point home is that it comes back again to the individual behind that. The person who has to drive that, but also more importantly, the person who has to receive that. They need to be able to be part of this, I will call, forming a process of adjusting and learning and doing things to try and make sure that we are ultimately responsive to what we are saying we are setting out to do. The nicest thing is that even what the objectives were set before, they can change. When you do that, it's a revolutionary. Because what you started with in 2024, coming out as something so totally different in 2034, is because you have gone ahead of a lot of curves. If we were speaking about the S curves, you saw that things are happening. Good, whilst they are happening, what is happening in terms of change? Let's bring that in. Oh, this one we're holding it dear, but we don't need it. Let's put it aside. But that doesn't mean you take off your values. You need to be sure what value system you are working on, because that's going to keep you going.
Bomi, thank you. Thank you for a very insightful, eye-opening conversation. My last comment and question for you is now perhaps just a bit of last words. What would you like to leave our oral health professionals who've been working in a stagnant, slow changing environment, slow responding environment, are despondent, can't see the value of their contribution in the wider and bigger system? Our policymakers, and lastly, those who are trying to lead in this space, what last words would you like to give them on reinvention and how to take on a transformative and truly transformative journey that will result in real and tangible impact?
Wow. Thank you for that. Thank you for that. Maybe what will help is to understand chaos. Chaos is not the absence of order. Chaos is the presence of many orders. So, which means many things happen. And for you to thrive in chaos, it means you discern what these different orders. The other one is going that way, and they've got a definite place where they're going. The other one's going that way. They've got a definite place they're going. But looked at it from a aerial view, maybe, you can see what these people are going like in different directions. There's chaos. No, it's not an absence of order, but it's the presence of many orders. Now, that will help anybody who is trying to do something to bring in their humanness, but also recognize the other's humanness. It might be wrong, or it's not in the right time, whatever is happening, but it's helpful to, what's the word, to put people, or let me put it simply, as to show love, compassion. In my mental fitness program, we talk about different stages in which you can go into to be able to bring out completely all that love and compassion, and more importantly, the results which you want against somebody who doesn't see it, and against yourself who you don't see, because negativity is flowing backwards and forwards. So before you judge that it's chaos, recognize that it's not that there's no order. It's just there's many orders to work with so that you can get to your goal. Because we need each other, practically speaking.
Yes.
At the end of the day.
And that is very true. That is Mr. Ntolosi, Chief Reinvention Officer at Heartprints Consult. Thank you for making time for us. I enjoyed this conversation, and I hope you enjoyed it as well.
Super.
And until we meet again, thank you so much.
Thank you, Dr. Vava.
Thank you.
This has been a wonderful opportunity. I
really
really enjoyed
it.
myself.
No, we really appreciate it, and I'm
Thank
sure our
you.
audience will as well. Thank you.